Hi guys, I'm doing my second video reaction in one night. Can you believe it? I probably won't release them at the same time because that would be thoroughly unexciting, but I thought I'll just do it now. Welcome back to my channel guys. For those of you who are new here, I'm Dawn and I'm a doctor in the southwest. My second video reaction is another doctor YouTuber. I feel like I'm a doctor. I loosely call myself a YouTuber. So to see other people's videos from the same area as me might be somewhat interesting. The one that I'm going to look at, and I'll just start my screen recording, record. The one that I'm going to look at today is the Violin MD. Violin MD. Let's get started. So I watched this one recently. COVID vaccine. I don't know if she is a doctor or if she's a... Oh, it says doctor. Oh, she's got quite a lot of views. Jesus, 2 million. I feel like maybe this might be out of my depth a little bit. Medical mystery. I feel like this one sounds exciting, so this is the one I'm going to watch.
Morning guys, I'm Siobhan,
Morning.
a fourth year medical...
It's actually nighttime here. I don't know. I think I just set my dogs off downstairs by shouting that loudly.
resident specializing in rheumatology.
I feel like she's been doing this a long time because she's very positive. I can feel the energy. I feel like I need to take some of her vibes. The other video I watched earlier, which made me want to make this video, I struggled to stop watching it. So, you know, she's got something about her that just pulls you in. And I think it's the eye contact, I think it's her voice, and I think it's her... She's very bouncy, she's got a very bouncy voice, and obviously adds a lot of intonation, I think that's the word, intonation to it.
Today we're covering the inpatient service.
She just sounds very excited about everything, and I feel like maybe I'm a bit more chilled than that. Or maybe it's like a thing that she puts on, like a kind of stage voice, I don't know.
For rheumatology, so
I think I do have to hype myself up quite a lot to, especially right at the start, to talk to nothing or talk to what felt like nobody.
So all 4 hospitals in the city, it can get really busy, so let's get going and tackle the day.
I used to play the violin when I was a kid. I remember assembly when I was in year 2. So I was probably 5, 6. My head teacher, I think he was called Mr. Moss, so shout out Mr. Moss from Lakeside Primary School, said it was the hardest instrument to learn. So I said, Mum, I want to learn the violin. I had to stop because my maths lessons clashed or something. Play you a few notes, but that's about it.
Okay, so as I was driving, I got a call from my attending physician.
She's got really cute freckles as well. And very nice skin. Wonder how old she is. I don't know.
Dr. Garner, so my supervisor, and she tells me that we have a consult in the intensive care unit. So there's a patient who's bleeding in their lungs. It's called diffuse alveolar hemorrhage. And that can be caused by some autoimmune conditions when the body starts to attack itself.
I feel like this is not what we call it in the UK because I've never heard of that.
And guess what? Those are the diseases that we treat. So today we're being asked the question,
Is she on rheumatology?
and could this be an autoimmune condition, and sort of help us figure out what's causing this? Okay, so let's start by reviewing the patient's chart to learn about his past medical history and what's been done so far. All right, so it looks like he's a relatively...
Bloody hell, look at that red keyboard. We've just got crisps in ours. They do not look like that.
healthy man in his 50s with progressive shortness of breath. He came to the...
What's going to be interesting is seeing whether I can work it out. So he was in his 50s, progressive shortness of breath, and he's on ITU.
hospital because he thought he might have COVID-19. While in the emergency department, he became more hypoxic and required intubation. He then had a bronchoscopy where a camera was put down into his lungs, and that's where they saw the bleeding in both of his lungs. Okay, so now that we've got the story...
Maybe he just did a really hard workout, because I've had that thing where you feel like you're coughing up blood when you've worked out really hard. Blood in the lung. I mean, my first thought was traumatic, but I feel like you'd know if you'd had a trauma and you were bleeding in your lungs. The second cause of blood in lungs that I can think about is a pulmonary embolus, where you get hemoptysis, which is where you cough up blood. I don't fully know his history, so he's short of breath, so I guess he could, but why would they call the rheumatologist? Like, it doesn't quite add up. I feel like if somebody's bleeding in their lungs, they would have done a CT scan. I'm guessing they're in Canada right now. You would have seen a PE. What they probably haven't seen is a PE or any other physical cause, so they're likely think it's autoimmune.
Story, let's go and see him. Entering the room, I see a middle-aged man who's unconscious and connected to a ventilator. I thoroughly examine him, hoping that I'll see some clues about the diagnosis, but nothing stands out. He's got rashes and no swollen joints. So we're gonna really heavily rely on blood work in this situation. So I'm gonna order a...
This is where the rheumatologist order... I feel like I'm saying she's a rheumatologist. I don't actually know. Let's have a look. Yeah, okay. Rheumatologist. I was making that up. They order some real crazy tests.
A full autoimmune panel.
And they've got the same medical equipment as us. That's weird, isn't it?
Kidney investigations and blood work for some rare infectious causes. So at this point, it's about waiting. The results are going to come back either tonight or tomorrow, but that's the hard part, waiting when the patient is so sick. Hey, everyone. How's it going? Oh, hey, Deborah, congratulations. Oh my gosh. Okay, wait, guys.
Okay, I was saying at the beginning that I was wondering if she was, like, acting a bit more enthusiastic, but I think she is just more enthusiastic.
You are meeting the newest member of the rheumatology team. So yesterday, right? Yeah. Was match day, and I can't believe it's been a year since that's happened to me. I actually made a video about that because it was so dramatic. But anyway, we're so happy to have you joining us here in the rheumatology program. This is great. You're going to be seeing a lot more of her.
I'm super excited.
Yeah. Okay, get back to work?
Yeah.
I have to get back to work. Okay. Oh, anyway, I'm so excited.
I've never been this excited for someone to join the team. I don't know if they're like long lost twins separated at birth or something, but I think this is a strong personality difference. Oh, I said in the in my last day in the life of a doctor vlog about the bleep going off and it being a bomb. But also what I find interesting is that she's on the ward, it looks like, and she's filming. Doesn't look like she's breaching any like confidentiality stuff, which is what I'm always worried about. And I'm not saying she's doing anything wrong, but I guess she's just a bit more brave than I am.
Okay, so that was a call from the pathology department at a different hospital. So yesterday I did a skin biopsy. It has to go for a special test called immunofluorescence, and apparently I forgot to sign the bottle and say like where the specimen was from, so they can't process it. And nobody else can go to the lab and sort this out, so I actually have to go to a different hospital just to sign this bottle.
I'm surprised they let you sign that bottle, Siobhan, because I feel like I've done it before where I've not done something correctly on a group and save, which is like a blood testing, blood grouping, and they literally make you do it again. However, this is a tissue sample, so I feel like it would be a bit mean to be like, go and do it again. I think it's from this patient's lungs as well, so it's, it's not like a small thing to have to do.
Oh, it's so frustrating. It's really gonna put me behind today. But what can you do? Don't want to waste the sample. But before we go to the other hospital, let's follow up on the other couple patients here so we don't have to come back here. Got a patient that we're following with...
I feel like from what I know about the rheumatologist at the hospital that I'm at, they have about 4 patients. So I don't know what it's like there.
Lupus, and another one with myositis, inflammation.
Oh, also, what I've just realised is that she is a 4th year resident, which I think means 4th year out of medical school. So it's basically, I don't know why I would think that I might be able to guess what this patient has if she doesn't know what it is, because it's not going to happen, is it really?
In the muscles, so let's see them quickly and then we'll go sign that paper.
It's making me quite thirsty.
So done with this hospital for now. We'll go to the other hospital quickly, and then we're gonna meet up with the rest of the team, Katie and Dr. Garner, after I sign this thing. Oh my gosh.
Oh gosh, she's got to drive.
Okay.
I wonder how far it is.
Next parking lot. Will you listen? Yay! Okay, good.
Does she get free parking?
Middle of the day.
Because I'm
like
jealous she
parking.
does.
So I realize I've never actually been to the pathology department, so this will be a little
Same sister.
bit of an adventure trying to find it.
No, the last time I went to a pathology department, I watched an autopsy, and I don't think I'll ever go again. Now the big question is, will she finish on time because of that?
Okay, so now we're going to review a patient that Katie saw this morning with a painful, swollen knee.
Look at those
Recently been here for
curls.
like over a month. He's back now, delirious again. He's been seen by urology because it sounds like there's sort of a traumatic Foley.
After telling Dr. Garner about the new patient in the ICU who's bleeding in his lungs, we head back to the hospital together to check up on him. And look,
Right, all the history I have is bleeding in lungs. I'm gonna guess alpha-1 antitrypsin deficiency. I feel like that would have come out sooner though. But that's the best guess I've got.
luckily the hospital's just across the street. So he's still critically ill, but he's at least looking more stable now that he's received.
I do feel like that's too easy. Not even sure if it's a rheumatological problem. I'm pretty sure is that the one where you get like kidney and like asthma symptoms?
Empiric antibiotics and a blood transfusion. Unfortunately, most of the blood work is still pending, so we won't have any answers today.
2 hours later.
It's like a small vessel disease. I really can't think because I literally have never seen it.
So I've got a long way to go before I become an expert in the area. It's going to be all about practice.
You always think everything's simple until you start doing it. And you're like, oh, actually it's not. It's like a common thing, like you don't know what you don't know. So you always think everything's simple until you start doing it.
So I wanted to give you an update on that patient from the intensive care unit with
Yes,
the diffuse
please,
alveolar hemorrhage.
Siobhan.
So he was a bit of a medical mystery, and now we have all the results back. So as I was telling you,
Great.
often it's caused by infection.
Was it very nice?
Suits my clothes. Very nice. How much?
Trying to do Borat.
And all of his cultures for bacteria, viruses, fungus,
Negative.
everything came back negative.
Yeah.
And then all of our tests for autoimmune conditions where the body is attacking its own lungs, those all came back negative as well. And then another resident, one of the intensive care unit residents, was talking to the family members and found out some new information. So unfortunately, this patient's been going through a really tough time, probably even worse because of the pandemic, and struggling a lot with mental health.
Oh
And
no. Overdose?
Actually been sort of fell back into using a lot of cocaine recently,
Ah.
and that's something we didn't know
Drugs.
about.
Well, you wouldn't know if he was unconscious.
Now, cocaine rarely can cause this type of bleeding in the lungs.
Sorry, the audio went a bit funny here, so I thought I'll just talk over it, do a little voiceover. So I went on to look up cocaine-induced vasculitis in the lungs because I had never heard of this, and as she said, it was quite rare. So it turns out I did learn something from her video, so thank you to the Violin MD. Overall, I enjoy her general demeanour. I'm not really quite sure who these videos are aimed at though. I feel like they're not aimed at doctors. Maybe they're aimed at like the public or people that want to be doctors, or I don't really know. I think that's what I'm not grasping. I feel like I wouldn't be able to watch, as a medic, I wouldn't be able to watch them for educational purposes. But it's interesting to see how her, you know, life is different in working as a doctor in other countries as well. Thanks so much for watching, guys. Don't forget to hit that like and subscribe button, and I'll catch you in the next video.
Outside, a little bit high on the feeling, can't seem to focus.